Good morning. I'm Dr. Christina Gentile, and I'm a board-certified clinical health psychologist with the Division of Digestive Diseases. Today, I'm going to be discussing the use of acceptance and commitment therapy for patients presenting with chronic abdominal pain and medical comorbidities. Before I begin, I'd like to discuss the challenge of chronic pain and medical symptoms that you may commonly see in your practice. As we know, pain contributes to significant distress and discomfort, and this can include maladaptive thoughts, pain-related catastrophizing, fear, and anxiety. And associated with this discomfort, we tend to see a lot of attentional bias directed toward the pain, meaning that the patient can become very hypervigilant on pain-related sensations, as well as pain-related discomfort, such as unpleasant feelings and thoughts and emotions. Ultimately, the patient might begin to engage in maladaptive coping efforts to try to avoid or get rid of pain. And ultimately, we see reduced quality of life as the patient tends to focus more on control efforts for pain rather than engaging in activities or behaviors that enhance quality of life or contributes to one's sense of joy. So we tend to view this as a vicious cycle of suffering. So when I meet with patients, what I like to discuss with them is how pain and their struggle with pain contributes to suffering, and that suffering can amplify pain-related sensations and experiences. In this context, struggle refers to one's thoughts, emotions, and behavior, what they do, what they think, and how they feel in relationship to that pain. And with the approach that I'm going to be discussing today, we're looking at if we can learn a new way of responding to pain and pain-related experiences to ultimately improve quality of life. So the theoretical framework that I'll be presenting is the use of acceptance and commitment therapy, or ACT for short. ACT is an empirically supported behavioral treatment that's been used for a range of medical conditions, including chronic pain, as well as different psychological problems such as depression and anxiety-related disorders. The goal of ACT is to promote observable behavioral change to reduce suffering. And we do so by focusing on steps that enhance values-based living to promote quality of life. We are not trying to eliminate or get rid of symptoms. We're trying to drop the struggle, so to speak, with pain and pain-related experiences so we can do more of what enhances quality of life. So the interventions are directed towards increasing what we call psychological flexibility, which I'll be discussing more in the next part of my presentation. But essentially what we're trying to do is we're trying to promote this sense of acceptance towards unwanted or bothersome internal experiences. So that may include thoughts, feelings, emotions, and pain-related sensations. And we're trying to promote behavior that allows for commitment and action towards living a valued life. So engaging in activities that provide a sense of joy and personal fulfillment is essentially what we're trying to enhance for patients presenting with chronic pain. And psychological flexibility contains different core processes that are all interrelated. And essentially what this means is that we're trying to flexibly shift attention, helping the patient become more present, being able to contact the here and now, even in the midst of pain and pain-related suffering, such as bothersome thoughts and feelings. And we do so by helping the patient learn how to become more willing to notice those experiences, as well as practice skills to transform their relationship with pain and distressing thoughts and emotions so that they can do more of what matters to them. And this may include different skills-based training to support improved adaptive coping with pain, and also promote goal setting that allows the patient to reconnect with important life values. Values can be anything from family, education, things that might allow for further professional development or personal growth. And so we use psychological flexibility as a way to lower suffering in the setting of chronic pain. So with our patient, we can look at how we can enhance psychological flexibility for somebody who's presenting with chronic abdominal pain. And I'll be talking more about this briefly as we continue in our talk today. And so essentially we're looking at disease impact. So how does that impact one's day-to-day experience? Hypervigilance, or the tendency to focus on pain, bothersome sensations, or the potential to ruminate. And that goes hand in hand with fusion. Fusion is the idea of our thoughts and emotions tending to dominate our attention and awareness, where we might start to obsess and catastrophize. And then we'll be looking at the tendency to engage in avoidance behaviors, attempts to try to get rid of or control pain, unworkable action, or rather maladaptive coping efforts, and remoteness from values. What that essentially means is the tendency to move away from what brings joy and meaning, because pain tends to be the dominant focus. So with our patient, we can look at how the different presenting circumstances contribute to what we would call then psychological inflexibility, meaning that if we look at the top of the pyramid, he's not present, he's very disconnected from his day-to-day experiences, as he's more hypervigilant toward pain and pain-related sensations. And he tends to have a lot of obsessive thoughts about the possibility of future pain episodes. And with this comes pain-related catastrophizing. And over time, we see a loss of self-efficacy and confidence in his ability to manage pain or engage in any other activities that were perhaps meaningful or fulfilling. We can also see then, if we look towards the bottom left, this sense of shutting down or unwillingness, meaning that when pain arises, it may trigger discomfort such as anxiety and fear, in addition to the actual physical intensity of those symptoms. And we usually see patterns of maladaptive thinking, such as pain is awful and will never go away, and avoidant behaviors, such as when pain sensations show up, he's likely to cancel plans and become more socially withdrawn. We also see patterns of unworkable action that can contribute to suffering. This patient has a history of ADHD, and he tends to forget to take his ADHD medicine. We know with ADHD, there's a vulnerability toward anxious distress. And so with his ADHD being unmanaged and having that vulnerability towards anxiety, we can also see unmanaged pain-related anxiety and how this impacts sleep. Since he tends to be up at night thinking about pain, he tends to then not be able to get the full amount of sleep that would be restorative. And so ultimately, we can see how that can impact daytime fatigue, daytime tiredness, exacerbate ADHD symptoms, and also exacerbate pain intensity. So experiential avoidance essentially means attempts to avoid discomfort. As we can see in the figure, when pain and distress show up, the person may experience bothersome sensations and feelings, and that may trigger sympathetic arousal and activation of stress-related pathways. And ultimately, this cycle can contribute to more pain and suffering, and then additional attempts to try even harder to get rid of pain and try to get rid of pain-related thoughts and feelings. So something that you can use as providers to assess quality of life and how pain might be impacting your patient's day-to-day experience is to do a brief screening using this tool called ACT UP. And what this stands for is A, for activities. How is pain affecting your life, or how is pain affecting your day-to-day activities or experience? C, coping. How are you coping with pain? What sort of things are you doing? T, for thinking or thoughts. What are your thoughts about pain? Do you think pain will ever get better? U, for upset, or we're looking at mood. Have you been feeling worried or down? Has there been a change in mood? And P, people. How do others respond to your pain? This is also a great question to get a sense at an individual's support system and if they turn to support of others. So this is a really lovely tool to use to get at quality of life and daily impact. So one question that I like to ask patients when I'm considering the use of acceptance and commitment therapy is to say to them something along the lines of, given the challenges you discussed today, or given the challenges that you shared today, are you open to trying a new approach? And I find this to be a very helpful question because it invites the patient into the conversation about treatment planning and also validating that they have been working hard to find some sense of relief and to improve management. And as providers, you might consider this question or posing your question in this way when trying to introduce different interventions, even if it's GI nutrition or GI integrative wellness or working with a psychologist. So when patients come to see me for ACT, we're trying to again promote psychological flexibility. And with that, we're trying to promote pain acceptance. And what I say to patients and providers is that acceptance is an active behavioral choice. It's choosing to allow uncomfortable, bothersome internal experiences. So again, pain, distressing thoughts, uncomfortable emotions, unpleasant sensations. So choosing to allow them and having this willingness to make room without struggling with them, meaning we're not engaging in unworkable action or avoidant behavior to get rid of them. And we're doing so because it frees us up so that we can take steps, no matter how small, in the direction of our values. So things that provide us, again, joy, meaning, or fulfillment. And so with our patient, we use different mindfulness skills to help him notice what his mind was saying whenever pain arose, and to bring him more into the present moment, and diffusion skills, so cognitive skills to help him transform his relationship with bothersome thoughts and feelings, and to gain some distance and perspective from those thoughts so we could interrupt patterns of catastrophizing or obsessive thinking. So an example would be when pain arose, the patient learned to say something along the lines of, I'm noticing a sensation of pain. Or if he was having uncomfortable emotions, saying, I'm having a feeling of sadness. Or I'm noticing thoughts about pain intensity. Or this is a moment of suffering. So with acceptance, it's choosing to allow and acknowledge. And this is a different approach in a different response to pain versus typical knee-jerk reactions of catastrophizing or obsessive thinking, where it starts to heighten stress arousal and can increase sensitivity to pain. When we use the approach of ACT, we can start to slow down, open up, and make room, and recognize that we can choose the path of acceptance so that we can start to allow our behavior to be more mindful and guided by our values. So guided in the direction of what's going to help us manage pain while also contributing toward things that are important and matter most to us. So it's a sense of willingness to bring this discomfort in the midst of pain and suffering so that we can do more of what is important. So I thought it would be helpful to also include a few more building blocks for you to potentially consider using in your practice. One of the building blocks is expanding awareness. So if the patient shows up in the visit and is becoming observably distressed or anxious or upset when talking about pain and perhaps feeling frustrated about not achieving symptom relief, I find it very helpful to use what I call the press pause technique. And something you might say is, gently acknowledge, you might even hand gesture to the patient and say, I'm wondering if we can take a moment to press pause and notice what's showing up for you right now. Why don't we together take a deep breath, slowly breathe in, slowly exhale out of your mouth, and just notice what your mind is saying to you right now as we talk about this difficult experience, talk about treatment planning. So with this, we're trying to get the patient to move from being stuck in their mind and maybe ruminating about what's not working and feeling very upset to helping them slow down, come into the here and now and notice their mind and start to take control of their breath. Another technique I like to do is cultivate a sense of willingness. So this is something that I use for patients who might be focused on searching for a cure or the cause of their pain and symptoms. And perhaps they're spending a lot of time searching the web or trying to find an answer. And maybe there might not be an answer that exists right now. So what I might say to the patient is, I'm wondering if you are willing to make room for this uncertainty with not knowing the answer right now, so that we can practice skills together to do more of what matters most to you. So this allows for an opportunity to validate that the patient has been trying and that managing their pain is important to them, but also develop a sense of discrepancy between this degree of fusion or being hooked by this cure-seeking approach or trying to find a cause, and how that ultimately might be moving them away from their goals and values to perhaps spend more time with family and friends and participating more in life. So those are two skills that I encourage providers to use in their practice when distress or difficult thoughts or emotions arise in the visit, and how to best manage it. Some takeaway points for today's talk with acceptance and commitment therapy is that it really allows for us to promote psychological flexibility. And what this means is allowing us to transform the relationship with pain. And this involves learning a new response to pain and pain-related sensations so that we can help patients learn skills to do more of what provides them a sense of joy and quality of life, even in the midst of suffering with pain. So again, we're trying to enhance psychological flexibility. So I want to thank everyone for your time today, for listening to my talk on acceptance and commitment therapy for chronic abdominal pain and medical comorbidities. Thank you.